Allan, CEO for the Athabasca Health Authority, and today I have with me Dr. Dion Marten from the Fond du Lac Minnesota First Nation, and Dr. Marten's been in the AHA facilities for a number of years now, I believe, right?
Almost 5 years now, yes. I've been an attending physician here at the Athabasca Health Facility.
And it's good you're home, and welcome. We're going to talk today about COVID and something that's really kind of dear in all of us right now because it is a fearful thing. From your experience so far, how has it been in dealing with the COVID virus as well as people who were infected with it? How has it been for you as a doctor?
As a frontline worker and just as a human being, COVID is very scary to see firsthand. COVID is real. COVID does bad things to people, causes severe respiratory lung illnesses. It causes an inflammatory reaction to the rest of the body where they can get inflammation in and outside of the lung, causing blood clots, which then affects the heart. It can cause issues with the skin, where the skin can break down. It affects the brain adversely, where people just kind of become forgetful and cloudy. I have seen patients here who have been sick and died within a week of COVID. I have seen patients here who have been admitted to Saskatoon or Prince Albert for months afterwards in an ICU on a ventilator.
And that's a ventilator.
Fighting to breathe. This is a ventilator. Yes, that people are hooked up to assist them to breathe because they can't breathe by themselves
You can't breathe
to
on
live.
your own, so it must be hard.
It is, yes. And to live in an ICU bed for 2 months, hooked up to a ventilator because you're unable to breathe and would die very quickly without this.
So your lungs are full of whatever the virus
Yeah, they're in kind of like just fluid and infection, and they're tight and they can't move to breathe air, and so this provides the pressure and support to allow.
So as a doctor, how do you comfort them? You look into their eyes, they're scared.
Oh yeah, it's very scary. It's very scary for everybody, and you hope, you just have to give them hope that they're gonna make it south and they're gonna weather this storm, because we just don't know. Healthy young people die from it, and elders survive with just a little bit of a cough and sniffle. But then it also happens the other way, where elders die from it and young people just have a little bit of cough and sniffle. We don't know to what severity a person's going to be affected by the virus, and of those who become infected, who will live and who will die. It's very random.
And the one thing that could help us is masking.
Yes.
Distancing, even though we're closed right now. We both have our needles. You have both of your shots. I have one of mine. Masking, washing your hands, all of these things, right?
Yes.
Yeah.
And getting the immunization. We all need to get the immunization to protect us, not just individually, but together as a group, as a community, for our households. An immunization protects us and everyone else around us.
And that's the good thing. And the ones that have it, they've had it already. They probably didn't notice it, but they're probably helping themselves and their community already.
Right.
It's a good thing.
Right.
So what do you want to tell people out there?
Well, we need to get the immunization. In AHA, we have only the Moderna vaccine, which is 2 doses, about 4 weeks apart. It's just a small little dose in an arm. And then coming back 4 weeks later for the same dose. There's really minimal side effects to the vaccine. It is not a live virus. There is no virus in the vaccine. So people cannot get the virus from the vaccine. What's in the vaccine is genetic material which our body incorporates to make a protein-like structure on the virus that our body will build resistance to, but there's no chance of getting COVID from the vaccine.
And that's proven.
That
Scientifically.
Right.
Yeah.
We can get a little bit of an illness, but that's a good thing. This illness, the fever, the achiness, feeling of all, that's our body actually mounting an immune reaction to the vaccination.
It's no different than getting a sliver in your hand and then 2 days later getting red around there.
Right.
That's your body fighting it.
Exactly. That's exactly what, and that's a good thing. We know that our body's actually responding to the vaccine. It's not a bad thing. If it's a little bit worrisome, rest, a little bit of Tylenol, but most reactions are less than a day, and people are back to their normal level of activity within 24 hours.
So needle or that?
Exactly.
People can choose.
And also to this day, young healthy people are still unwell months and months after being infected with chronic shortness of breath, chronic fatigue, poor concentration and memory, and we have no clue as to how long that will last for.
Yeah, I'm not going to put you on the spot, but I'm going to teach you Dene.
Okay.
And you're going to tell the Dene audience out there
Okay.
about getting a needle.
Okay.
Okay? All you got to do is copy me.
Okay.
Okay? Okay?
Sure.
Listen. You're going to tell the people out there. Nugui.
Nugui.
Yeah. Nuljer.
Nuljer.
Sonna.
Sonna.
Yeah. Get a needle. Don't be scared.
Okay.
Yeah, you did it. You said it. You said it. So, okay, Dr. Marten, thank you for your time today. And we hope that, our trend continues. We've been zero for almost 11 days now, 12 days. Really good record. And just be really careful out there because, the variants, again, that's the worrisome part, the variants, right?
Exactly. Right now in Regina, it is the hot spot in Canada for the variant COVID virus. As maybe some people know, Regina is going into complete shutdown mode this week.
Sunday, right?
Right.
Yeah.
And that could possibly be the rest of the province or the rest of the country if this variant spreads and causes a lot of illness. So it needs to be contained, and people here and for the rest of Canada need to prepare themselves for the possible variant, which is much more lethal than the first COVID virus.
And it's always going to do that. It's always going to get worse. It's a virus until it suddenly stops.
Until the herd immunity contains the virus, the virus will continue to mutate as vaccines come out and treatments come out. The virus is going to mutate around those treatments, and it will get worse.
It's smarter than us.
It's smarter than us. Viruses have been around for a lot longer than we have.
Yeah, and all we got to do is avoid them. That's it.
Exactly.
That's the easiest way, and get the needles.
Exactly. Mask, hand washing, social distance, immunization.
Okay, I'll say what you said in Dene, just in real brief, just for the Dene audience out there. Masicho. Adunja no hilda Dene. You see Dr. Marten at the you think Kwanzi Dene Suntlina Cecilia Marten Chu Eduard Marten Nibi is attain. I do no hillian hiduri data nede no nizin their COVID-19 key. But Adene by Yare need cheat in about her now, need zio, or you a sick edge niddy diha as a nithni. Did it Adene Hilla Nasi it Adene Hola Nathis Tihudi Yahini. The haunted then a Suena Holy, then a Golioli, down Haget had tuned the Bede had few, a Yerare had Gides on a Yede had G had Dua. Yandria Tidon Lihini, Nukuyu. Chazi the notio, massing on you, Nelaga not Silu, a sick Halezino by Sananifni, Adrit Adene, Dizinanaho, Taka, no right digi, Allu no baho aya se nikui ha. Dana sa he gui Alun tan tibet al yare sa rajade castanerion el nini de data banil niha. E kodita na de yatinori. What's Dr. Marten?